Hi friends, Dr. Nancy Trimbley here, putting the power and knowledge of your health back in your hands. So I am really proud of you for getting the laser. You've probably already been using it because you watched the basic course. And now you've got a surgery you've just had, or you have an injury that you're healing from. And the body heals in a very specific manner and phase. Like, we know there's inflammation at the very beginning. And the inflammation, the swelling response is actually good and normal because there's all kinds of things going on behind the scenes of your body clearing away the debris of the injured tissue, whether it's a true injury or surgery. And the swelling is protecting the area. It is drawing chemicals into the area that produce pain. So if you're experiencing pain, it's because your body is doing that on purpose to keep you from injuring yourself more. So, but with that said, all along the way, we can use the laser to reduce healing, speed up the process, and allow those underlying tissues to heal at their maximum. One rule: if you injure yourself, let's say you stub your toe and you're like, oh my goodness, let me get the laser. You have to wait 20 minutes after the injury because your body needs that inflammatory response. Just like I was saying, your body needs those underlying chemicals doing their behind the scenes job. So you have to refrain from using the laser for 20 minutes. After that, you would, of course, follow the priority principle. You would use laser for pain and then swelling, and down the line. Now, what about if you've had an injury or surgery and you have, let's say it's like it's your forearm and there's a bandage on it? That's okay. What if there's a metal plate in your arm? Like somebody I lent the laser to, they had to get a metal plate put in their arm. That's fine. The laser goes through bandages, goes through metal. It's best if it's right on the skin, but okay, no problem. It's not on the skin. Don't worry about it. You can, and even if, let's say, you have an injury and it's so sore you can't even touch it, you don't want to put the laser right on it, you can hover the laser above the skin, and that's great. That's fine. I have an article that I'll be posting probably with this course about a doctor in Boston that was treating somebody with COVID, with the respiratory illness, with the laser. And the laser works great on the lungs and coughs and things like that. So, so that was pretty cool. So I'll post that for you to see. So now sometimes if you have an injury or a lot of swelling, and you think you're supposed to use it for 5 minutes, but it gets like 1 minute in and you're like, oh my gosh, I can't even hold it up here. It's just I can feel the laser. That's okay. Just stop. Just use it for 30 seconds or a minute. That's okay. Just as long as you're using it. And when you use it for that short of a time, you can use it multiple times throughout the day. Let's see. All right. So you've just had your surgery, you've just had your injury, let's say you're just home, you can use the laser immediately. As long as it's past 20 minutes, you can use the laser immediately. You start priority principle with pain, use it for pain relief. I'm going to tell you, the pain is going to be reduced significantly and quickly. It is that amazing. Then you go into swelling because the body still is, swollen from repair, but and the swelling may still occur. It's not like you're going to completely dismantle the body's healing ability at all. You're just managing it so it moves along more quickly. Keep in mind, surgeries and injuries, sometimes there's so much debris your body's cleaning up that the lymph nodes can get clogged either in your armpits or in your groin. And just like I taught in the basic course, you're going to use the laser on those areas, whether it's your armpit or your groin. You're going to use that woodpecker, how it, let's see if I can do this. It's just going to be a pumping action on those groin and armpit lymph nodes, depending on where your surgery or injury was. So do that so that the lymph nodes can, like a sponge, get wrung out, and so they can gather more debris and help your body process that more. As you progress and you're following the priority principle, you've reduced pain, you've now reduced the inflammation, and both of those things could take a few days to a week or two. Then once that swelling is gone, then you can switch to the healing mode, which is on that 50 hertz. And you may stay on that for 2 weeks, but just like I teach in the basic video, you want to use it for 12 sessions and then quit. Take a 1-week break. The 1-week break is actually your body working and using all of that laser energy you put into it. So it's not like things have stopped. You're allowing your body to catch up. Then you can do another 12 sessions. So about 2 weeks again at program 50 hertz, the middle one, the healing one. So taking those breaks is necessary. And you can do that for 3 total sessions. So 12 sessions, take a 1-week break, 12 sessions, take a 1-week break, and do a third one for 12 sessions. Now thereafter, you might want to quit for a while to allow, again, your body to catch up. One more magical thing. In the basic video, I talk, actually on the bonus video with the basics, I talk about oxygenating your blood. You can do that with the laser after every treatment that you do. This is especially powerful when you're in that healing phase. So it's good to do with pain and reducing inflammation, but when you're in the healing phase, make it a point to spend 5 minutes on 5 hertz. 5 minutes, 5 hertz. It'll really help you to feel much, much better and help those tissues get the oxygen they need to rebuild much more quickly. So I hope that helps. Of course, if you ever have any questions, we are just an email or a message away. So putting the power and knowledge of your health back in your hands. Congratulations on getting your TerraQuant Solo. Bye for now.